Why is Optician eyewear insurance so confusing? Imagine trying to navigate a maze every time you want new glasses or need an eye exam. That's often how people feel when dealing with eyewear insurance. It's meant to help cover costs for routine eye care and glasses, but it can seem complicated and full of surprises. The main reason is that eyewear insurance, often called vision insurance, is quite different from medical insurance for eye diseases. While both are important, they serve different purposes and are structured differently. Vision insurance mainly covers things like annual eye exams, prescription glasses, contact lenses, and sometimes discounts on lens upgrades like anti-glare or scratch-resistant coatings. It's designed to keep your eyes healthy and help you see clearly for everyday life. Medical insurance, on the other hand, covers more serious eye conditions such as glaucoma, macular degeneration, cataracts, and injuries. These requiring diagnosis, ongoing treatment, medications, or surgeries, which are usually not covered by vision plans. One big reason for the confusion is that plans vary a lot. Different insurance providers and plans have different rules about what's covered, how often, and how much you pay out of pocket. For example, some plans might cover the full cost of basic frames and lenses for children but only give a partial allowance for adults. The phrase, covered in full, can be misleading because it often applies only to specific basic products or limited scenarios. Many plans requiring co-payments for materials, and if you pick more expensive frames or lenses, you'll have to pay the difference. Another confusing aspect is understanding what isn't covered. Vision insurance usually doesn't pay for non-prescription glasses, sunglasses, or over-the-counter reading glasses. It also generally excludes coverage for diseases or injuries. If your eye exam reveals a problem like glaucoma or macular degeneration, the ongoing care, medications, and surgeries are billed to your medical insurance, not your vision plan. This distinction can be tricky, and many people get frustrated when they expect their vision insurance to cover treatments for serious conditions but find out it doesn't. From a medical perspective, it's important to know that vision insurance is not a substitute for medical insurance. Routine eye exams can help catch early signs of serious diseases, but managing those diseases requires medical coverage. For example, if an eye exam detects early glaucoma, the doctor might recommend medications or surgery later on, and those treatments are covered by medical insurance. Patients at risk for diseases should have both types of coverage and clarify which services are billed to which plan. This helps ensure they get the right care without unexpected costs. To make things clearer, always review your insurance plan details before scheduling appointments or buying glasses. Contact your provider to ask about coverage limits, co-payments, and exclusions. Talk to your care professional about which services are routine and which are medical. Remember, some services or upgrades might require paying out of pocket. Using health savings accounts or flexible spending accounts can also help manage costs for services not covered by insurance. In summary, eyewear insurance can be confusing because plans differ widely, and the fine print often makes it hard to know what's covered. The key is understanding the difference between vision and medical insurance, especially when it comes to eye health and serious conditions. Always verify your coverage, ask questions, and work closely with your care team to make sure you're getting the right care for your needs. Consulting with healthcare professionals is the best way to navigate this complex system and protect your vision health effectively.